I've seen a lot of finger amputations and amputees. Like, y'all, you guys need to be careful when you're cutting vegetables or slamming doors shut. Goodness. Hi everyone, welcome to Jenn's Med Life, and I'm back with another video on my surgical rotations. So this video will be on my 1-week plastic surgery rotation. So they offered us 6 weeks of general surgery, but since I'm interested in plastic surgery, I asked my supervisor if I could cut that time in half and do 3 weeks of plastic surgery and 3 weeks of general surgery instead. And he said yes. But unfortunately, because of COVID, all elective surgeries were canceled, so I didn't get to see as many surgeries as I had planned. Even the plastics clinic was fairly slow during this time. So after about a week, I decided to cut my 3-week rotation into 1 week and just finish up 5 weeks of general surgery. I was a little sad, but that's okay because I actually had a good time in general surgery. Alright, so I'm gonna go ahead and start with a fun fact about UK rotations. So in the US, they call the senior doctors attendings, and in the UK, they call them consultants. Also in the US, they call their junior doctors residents. And depending on what year you are, you're considered a PGY 1, 2, 3, 4, etc. PGY stands for postgraduate year. And also PGY 1s are usually referred to as interns. But in the UK, they call junior doctors a variety of things. The first 2 years, they're considered FY1 and FY2, which stands for Fundamental Year 1 and Fundamental Year 2. Then they become CST or IMT, depending on what specialty they're in or what specialty they choose. CST stands for Core Surgical Training and IMT stands for Internal Medical Training. And then they become an ST3, which stands for Specialty Training Year 3, and depending on your area of expertise or specialty, then that goes on for several more years, so ST4, ST5, etc. And then finally, you become a consultant, aka attending. So yeah, it's pretty long. What does a plastic surgeon do? Plastic surgeons are focused on the restoration, the reconstruction, and the alteration of the human body. They can construct any part of the human body except the central nervous system. Now, a plastic surgeon is different to a cosmetic surgeon. Many plastic surgeons choose to become cosmetic surgeons, but not all cosmetic surgeons are plastic surgeons. So what is a cosmetic surgeon? A cosmetic surgeon does procedures to change the aesthetic or the appearance of somebody. Any licensed physician is legally allowed to do cosmetic surgery. So just be careful out there and make sure the people you're choosing to do your cosmetic surgeries are licensed and trained and also know what the heck they're doing. Don't become a botched story. What was my day like? I was in a plastics clinic at 8 a.m. for handover from night shift. Then I either went straight to theater for any morning surgeries or I would go on ward rounds. After ward rounds, if there were no other surgeries booked, which was most days because of COVID, I would stay in the clinic and see outpatients. I actually didn't expect to do as much and see as much as I did in the clinic, but I was pleasantly surprised. So all of the procedures that I mentioned in this video were done in the clinic unless I specify otherwise. Procedures I observed the debridement and dressing change of a superficial burn. They used to call these first-degree burns, and here's an example of what it looked like. So they put chlorhexidine on a gauze, and chlorhexidine is comparable to iodine, which is this little package that I have right here. So they poured that on the gauze, and then they literally scraped the loose skin that you see, like the blisters. They scraped that off of her skin, and this woman was in tears. Like, it looked so painful. Like, I felt her pain. But they had to do this to make sure that her skin would heal properly and also to prevent any infection. I observed a lot of dressing changes. The nurses were the ones who usually did these. One gnarly dressing change that I saw was of a psych patient who had chronic gaping wound on her arm. She kept cutting into her arm, and it would heal, and then she would cut and then it would heal. They even found a piece of plastic from the plastic knife that she was using to inflict her wounds. They talked about giving her skin grafts in the future, but I think they need to get her medications under control first before they attempt to cover that up. Because her muscle was exposed and everything. It was pretty bad. I've seen a lot of finger amputations and amputees. Like, y'all, you guys need to be careful when you're cutting vegetables or slamming doors shut. Goodness. I don't know about y'all, but I need my fingers. Okay, so just be careful. I observed the foreign body removal, which was a splinter, a wooden splinter. It was pretty big, actually. They did a washout and then they closed the wound. I observed a nail bed repair. So the patient smashed his finger and half of his nail fell off. He also had a laceration on his nail bed. So the surgeon had to throw in like 3 stitches on the nail bed and yeah, basically clean it, throw the 3 stitches in the nail bed and dress it. And his nail will grow back in a couple of months. I observed a head laceration repair. Basically, they just cleaned the wound, so they did a debridement, then they sutured it and dressed it. I observed the manipulation of a dislocated PIP joint in someone's little finger, and PIP stands for proximal interphalangeal. It looked similar to this picture. It was pretty cool to see how they administered the local anesthetic for the nerve block, and also how he had to manipulate and bend the finger back straight. I observed the wire pin removal from a guy's thumb. He sustained a mid-shaft thumb fracture due to a dog bite. The pins look similar to this picture right here, except he had pins going crisscross, so one went through this way and another went through this way. And he had that in for about 4 weeks. And that day he came back to get the pins removed. And so you can tell, you can imagine after 4 weeks how much resistance was needed to pull those pins out. I observed a left flank and thigh split thickness skin graft and the application of a VAC. And a VAC is a negative pressure wound therapy. In case you didn't know where your flank was, this is where your flank is. So he needed a skin graft from his mid-torso, from the side of his mid-torso all the way down to his thigh. Procedures I performed. I was able to do a couple of blood draws for some inpatients. I sutured an interior leg laceration with some simple interrupted sutures. His tibia bone was exposed and his anterior tibialis muscle was slightly injured. The surgeon repaired his muscle by suturing them back together, and then he allowed me to close the skin. Also, because his bone was exposed and also because he fell into a gutter, that's how he got his wound, we had to make sure that his wound was well irrigated before closing him up, and he also received a tetanus shot. I helped with suturing a guy's hand lacerations. His hand actually went through a glass table. He said he was drilling something and it went through a glass table. So I asked if I can take a picture of his finished work, and he said yes, so this is the picture. He had a ring finger laceration, a dorsal hand laceration, and he had a skin flap hanging off of his pinky finger, little finger. I did a mixture of sutures here. I did some simple interrupted sutures. I did some vertical mattress sutures and some horizontal mattress sutures. I assisted with a thenar eminence laceration repair. The surgeon had to do a digital nerve neurosynthesis or repair because the nerve was actually literally cut in half by the knife that cut them. So he needed to suture the nerves back together, and I mean, that was just so amazing to watch. Seriously, that was really cool. He used the thinnest, tiniest suture I've ever seen. It was a 7/0. Supposedly they go up to 11/0. I've never seen one that little, and that would be really cool to see. But yeah, this was a 7/0 and it was really tiny, but it was really amazing just seeing him suture those nerves back together. And after he sutured the nerves back together, he allowed me to close the skin with simple interrupted sutures and horizontal mattress sutures. I assisted with the washout and debridement of a volar oblique traumatic injury. So the lady's middle finger was crushed under her wardrobe, like it fell on her finger. The nail was still intact, but the pulp was completely gone. And her bone was actually exposed underneath, and it was crushed too. So we had to take out all the crushed pieces of the bone and make sure everything was out. Then we cut her fingernail in half so that we had enough skin to fold over and cover the front of the avulsed flesh. And that skin covering, that skin flap, it would help with healing and also to cover the exposed bone. And she's a hairdresser, so it sucked that this happened to her because, you know, this is how she makes her money, with her hands. But she was actually in pretty good spirits. We were able to save the majority of it, I mean, most of the tip of her finger, so she'll still be able to use it, but it might take some getting used to because it's now shorter, just a little bit shorter. Oh, I'm so sorry, I've been flicking y'all off, haven't I? Y'all, I'm so weird because the whole time I was thinking, is the pulp of her finger still underneath the wardrobe? Can I see myself doing this for the rest of my life? Drum roll, please. Duh, of course, I love me some plastic surgery. As of right now, my ultimate goal is to become a pediatric reconstructive plastic surgeon, but I'm open-minded and willing to see if any other specialty will change my mind. For right now, OB-GYN and urology are pretty up there, pretty close. But yeah, there's just something so magical and artistic and futuristic about plastic surgery that draws me to it. So that was my 1-week plastic surgery rotation. I hope you enjoyed it. Please don't forget to comment, like, and subscribe, and stay tuned for my next video, which will be on my 5-week general surgery rotation. All right, I'll see you guys then. Bye.